Did you know that anxiety and depression crosses the placenta and does affect your baby? Keep watching as we go over anxiety and depression in pregnancy and natural treatments to address it today. Bonjour! Welcome to La Clinique Molière, where we increase awareness and improve the quality of living. I'm Rachel. I'm a family nurse practitioner. I'm also a certified nurse midwife, and on this channel, we talk about mindful living, self-development, women's and maternal child health. Let's get to it. Negative emotions such as anxiety, stress, depression, all based on fear, and those exposures in pregnancy can impact your baby and birth outcomes. Research supports that all of these negative emotions, anxiety, stress, depression, based on fear, does cross the placenta or transfer through the placenta and impacts your baby. It can cause shorter gestation or preterm birth, low birth weight in infants. It can also cause neurodevelopment and cognitive and behavioral issues in childhood development. So mindful of how you're feeling. I like to start the day with journaling. Okay, so that helps me just start the day before doing anything else, before checking my phone, before checking email. I start the day with journaling and I just feel out how I'm feeling, what's going on for the morning. I take recommendations from Abraham Hicks. It's segment intention. So I set segment intentions for the day. So if it's gratitude or how I'm feeling, anything that I'm feeling, I'm journaling and putting that down on paper so that I'm in touch with how I'm feeling. Also, meditation is another great way to be mindful, okay, and connect the mind, body, spirit. So you're quieting the mind, quieting all the chatter. Most of that anxiety, depression, you're going to have a lot of negative thoughts with that, negative feelings, emotions. Meditation allows you just to press that reset button and just to start with a quieting the mind for the day. So journaling and meditation are the two practices that I don't get my day going without. Another great treatment is birth affirmations. It's going to be key. Birth affirmations, because it's significant and specific to pregnancy in this case. So you're gonna just create a few that resonate with you more. My favorite line is, "Nothing's more important than how I feel," right? Because my current present emotions are creating my next moment. Okay, so just like the pregnancy, your current state and emotions are creating your birth experience, creating your birth outcomes and childhood development, right? All those fetal development. So remember that when it comes to how important it is of how you feel. So that's going to be a big way to do a emotion check. Okay, just and be sure that you're present in the moment and that you are aware of how you're feeling. It's knowing the implications. So knowing that my present emotions is impacting my physiologic state, impacting fetal development, impacting childhood learning and cognitive abilities, so many implications. So that's going to be your emotion check. It's going to be your mental health check, and why it's going to be so important because it's impacting more than just yourself, of course, in this case. I'll be sure to include a link in the description box below, some of my favorite pregnancy affirmations to get the day started. You can also listen to them throughout the day, and those would be some of my recommendations for some of my favorite ones that I recommend to my clients. And a few affirmations are, I experience less anxiety today about my pregnancy and my baby. My baby and I are safe. Pregnancy is natural and healthy and safe for me and my baby, etc. So you can decide and adopt, multiple affirmations, but whatever works best for you and whatever resonates most with you as well. Your baby feels that too. So remembering that my baby feels that too. My baby feels what I'm feeling is another great way of controlling your emotions more effectively, not allowing loved ones, your partner, everyday happenings to impact your mood or fluctuate your mood. You're already going to have the hormonal effect of mood fluctuation, so don't allow external factors to impact your mood, hence impacting your baby. Social support is going to be really important. Okay, so you got to know when to ask for help, and you have to have the right people around you because it is impacting your mood, impacting how you feel. And remember, nothing's more important than how you feel. Okay, so another way that most of my clients manage their anxiety, depression, and pregnancy is through counseling or therapy. A large population addresses it with, without medications, just with counseling and therapy alone. Of course, you have to advance treatment if you need to, but in this case, starting with counseling, maybe talking about how you're feeling, communicating, expressing yourself, communicating effectively of how you're feeling and being in touch with those emotions, similar to journaling, but you're just verbalizing how you're feeling. That's another great way to address anxiety, depression, and pregnancy. Essential oils are my favorite. I don't leave the house without a select few essential oils. So, aromatherapy is going to be big when it comes to natural treatment for anxiety and depression in pregnancy. And some are bergamot, lavender, and chamomile. I like to maybe put a couple drops on my pillow, or maybe put a couple drops and put it on my temples or the back of my neck, or smelling it throughout the day, just having it on my person. So when I need it most, or if you have a trigger, or if you feeling, high anxiety or depression. Diet, diet, diet. So on this channel, we always try to link you back to diet and hydration. In this case, it's no different. Iron deficiency, vitamin D deficiency, B12 deficiencies can all associate with increased risk for anxiety and depression in pregnancy. So taking your prenatal vitamins is going to be key. Also, maybe taking additional supplements for vitamin D, for B12s, you name it. And then for iron, of course, you want to seek professional advice from your healthcare provider in that case, but sometimes you have to take an additional dose of some of those supplements and vitamins just to be sure you're getting adequate supply. Exercise, exercise, exercise. Okay, so yoga, walking, whatever it takes, get to moving. Okay, so exercise is going to increase your happy hormones such as endorphins. Okay, and help to boost your energy, boost your happiness, boost how you feel and your mood quality. So you want to be sure to get to moving. It's going to be such a key element to decreasing anxiety, depression, and pregnancy. Also, sleep quality is going to be another big one. That's very challenging as you progress in pregnancy, but be sure to watch my other videos on how to improve sleep quality for some really great tips on nature, spending time with nature. Okay, so nature and sunlight increases your serotonin, your happy hormones, so it stabilizes your mood. So getting out there, getting sunlight is going to be another easy, accessible way to increase your mood and your happy hormones and to decrease anxiety and depression in pregnancy. Acupuncture is another great way and often overlooked way to treat multiple series of illness and conditions and disorders. I do acupuncture for overall well-being to promote wellness. So there's so many benefits again, but I would highly recommend an acupuncturist, and especially when it comes to treating anxiety and depression in pregnancy. That is it for this video. Leave a comment below if there's something you learned today, anything that you might be able to use and practice starting today. Be sure again to like and subscribe and comment below so we can build our community and increase awareness and improve the quality of living. Merci. Au revoir.